we're celebrating 26 years of really a commitment to the community to reduce some of those health disparities, those burdens that our community has, by providing these early detection screenings free of charge. And at the same time, we are providing them with the education that they need about all kinds of health and wellness issues. And so our goal is really, commitment versus convenience. We are very committed to the community.
It's vital to take advantage of these events because there are so many services out there that community members are not aware of, and even if you don't need them yourself, chances are you know someone in your community that does. I actually had a breast cancer scare when I was 18 years old, and so it's important to me that I get checked more frequently, so even though I'm checked once a year, I will take any opportunity I can to get rechecked.
I'm happy to say that we have a lot of resources, we have a lot of information, and if we don't have something, we can find it for you. As we know, health care is not a privilege, it's a right, it's a basic human right. My dad passed due to COVID complications, and so being able to be here and seeing how legislation comes, how we bring up the issues, and we just gather all the information from the community, it just fills my heart, and so that's why I'm here.
From a basic comprehensive eye exam, we can detect over 270 diagnoses just from a simple coming in and get an updated prescription on glasses. It's important that you get an eye exam every year. If you're diabetic, it's important that you get one every 6 months. And so for me, it's so much more than just new glasses or new contacts. It's a great way to make sure that you're getting proper health care.
It means a lot to be here as NHMA. Getting down to the community level is really important for us. So any opportunity that we get to kind of get out of the office a little bit and interact with the community that we serve, our physicians and the patients.
This is what this is all about. So you want to sit here and say, well, you're not being included or this and that. This is what we're here for.
I'm here to give information and resources for memory loss, memory concerns, and Alzheimer's disease. In Black and Brown communities, the chances of getting Alzheimer's disease is 2 times more likely than white individuals. We have support groups, a 24/7 helpline number. That's a free resource. We have Spanish caregiver support groups and lots of information.
Being able to promote the healthcare and have people know that there are resources for them to go to is essential for people to be able to take care of themselves and their bodies.
We know without being out here that people will not know what services that they can provide, and that we wanted to make sure that we're, especially with maternal health being such in the newspapers and things of that nature, that it's very important for people to know that what services they have available to them.
Mental health is important. It's part of overall health, public health. So NAMI Illinois focuses on mental health, mental wellness. It's really important to kind of talk to community members to help people understand and be part of like the greater public health kind of conversation.
LS is here today to raise awareness about our support programs for patients, caregivers, and community members. So we provide information, education, financial assistance, and emotional support. Unfortunately, leukemia is the #1 most common childhood cancer. So we have a lot of resources developed for kids and young adults.
We are celebrating 26 years, and it's been like 357,000 folks, last count in December last year, that we have gone to our events and have received our services. So our goal is to make sure that all Latinas and even Latino men get their early detection screening for breast cancer, and also we have programs for cervical cancer, and now also we're working on colon cancer. So we're here to help our community.
It's important that our community knows that these resources are here. We have to reach health equity, and we are the only people that can do it. It's us at the bedside, it's us on the other side of the bed, it's us giving that communication and trying to build that trusted network. Thank you to the local sponsors that are here today that are allowing us to make this happen. Sometimes it's just that financial aspect that we find that we have the passion, we have the heart, we have the goals, but sometimes it's just a little bit of a barrier, the same barrier that our community sees, but we're in it together.
Our focus in our training of community health workers and promotoras is called Preparing for COVID Aftershocks. We all know that, the COVID has impacted our community, our body, mind, and spirit. So when we look at the mind, we're looking at the mental health issues that have risen from COVID. When we're looking at the body, we're looking at the long COVID and other respiratory diseases. And then when we're looking at the spirit, we have to realize that some of the people have no faith in our medical system, in our research system. And so we really want to get to, the misinformation that's out there and debunk it.